It's not always what is best for us, but it's also what is best for the patient as well as for the site. If you do a 100 vial kit for a site that has a pharmacy at a hospital, then it's easier because it has more space. But for example, you have a lot of dialysis sites, especially in the US, that are at a mall, and they don't tend to have very big freezers or fridges. So if you give them a 100 vial box that is very huge and takes up one of the shelves, you might get some issues with your sites. You do have to think about that when you're designing your protocol, and also how you're going to implement that in your IRT. And then the dosing regime. That's also always related to how your patient kits are designed. So are you going to be dosing 5 days a week, 3 days a week, once, and then your patient kit will be dependent on that. And you also have to think about stability. Do you have short expiry dates? Do you have different temperatures? One might be room temperature, one might be -60, and the other one might be -20. How are you controlling all this? Are you taking into consideration temperature auto-resolution in your IRT, for example? Are you going to be managing all your temperature excursions in the IRT? How are you going to manage that with your quality team? All of those are things that you need to consider already at the protocol design stage.